Hello, good afternoon, everyone. Thank you for joining our webinar today. Today will be the last installment of our series of webinar that organized by the Department of Psychiatry, Universiti Putra, Malaysia. So we have started our journey somewhere around in September when we first started to promote about mental health, especially during this COVID-19 pandemic. So we started our journey with Dr. Eugene talking about mental health. The world needs all kind of mind. Then the second installment is about the new normal of mental health. I think the highlight of our webinar now will be shifted to Dr. Aishah. Dr. Aishah is a psychiatrist and also a senior lecturer in the Department of Psychiatry in Universiti Putra, Malaysia. So she's a very dynamic psychiatrist with a lot of experience in treating patients with mental health issues. I think she is the best person today to share with us towards a new understanding of mental health. So I will pass the stage to Dr. Aishah, and also I will invite all the participants to type in your questions in your Q&A, and we will do a Q&A session after the presentation. So I will read through the questions and later we will talk about it. So I'll pass the stage to Dr. Aishah.
Thank you, Dr. Ang. Thank you for the kind introduction. So I will start off by talking on this topic of towards a new understanding of mental health. And I think when we talk about towards a new understanding of mental health, in this context, when we talk about new, we're trying to understand what it means is basically we're trying to understand it better, right? And by understanding it better, therefore we might be able to help improve our own mental health and also people around us, right? So moving forward, our journey in life is basically just probably like this road, if you can see. It can be straight, it can be curvy, it can have a beautiful view around it, or depending on our perspective at the time, it can be seeming quite lonely rather, right? So this journey of life can contribute to our mental health. And as we go on in this topic, I think I would be discussing some aspects of mental health and also mental illness with regards to some challenges that we may experience in our daily life as well. So these are the some of the what I call as the outlines that of the topics that I'll be talking about for today. Right. So before starting, I think it's most important for us to understand what is mental health. And I think many people would know this. A lot of people would have seen this as part of what we call as a World Health Organization's description or definition of what mental health is. And basically mental health is what we call a state of well-being. So when a person is well enough to be able to handle the normal difficulties of life, what everyone else experience, they are also able to handle in similar situations. They are also able to know their own abilities. And when we talk about abilities, we're talking about, acknowledging their strengths and being able to enhance these strengths, and at the same time, realizing certain weaknesses that we may have and also working on improving it, right? And next, being able to work productively. And we talk about working here. When we talk about working productively, we're not necessarily talking just about an occupation, you see, because everyone has different roles and responsibilities in their lives. So if we're talking about a mother who is a housewife, being able to run the household chores, managing the children. When we're talking about students, we're talking about the ability of, focusing on their studies. And the same goes for workers out there who work in their own different fields and their ability to do their job productively. And finally, we're talking about the ability of a person to contribute back to their community. And when we talk about community in general, we're not talking just about being able to give back to the country, at a national level or international level. Sometimes this contribution can be as simple as the contribution back to the small nuclear or extended family or neighbors around you, friends around you, right? So being able to do all four of this is described as, having a good state of well-being and therefore a good mental health by WHO, right? So then what is mental illness, right? So when we talk about the mental, right, we're talking about three elements, which actually comprises of what we talk about when we talk about the mental component of a person. So when we talk about mental, we're talking about the person's ability to think, the person's ability to feel, and also the person's behavior. So any issues that can have a negative effect on the way a person thinks, the way a person feels, and the way a person behaves can actually be considered one way or another as an impairment in the mental health, or if we were to consider it further as a mental illness, we would consider when the person actually has a disruption in function due to issues in these three areas, right? So, however, when we talk about normality in this context, right, we need to understand that, it depends the behavior, right, of a person, how the person feels and thinks. It depends a lot on the context when the behavior, thinking or feeling occurs, right? Especially in our cultural setting, in our multi-faith, multi-religion setting, sometimes certain behaviors and certain ways of thinking are actually accepted and understandable, and therefore we may not be able to commit to say that this person actually has a mental illness or a mental health problem, because it actually is accepted by that particular culture or community, right? So moving on, I think a simplified way of explaining about mental illness would be trying to understand it as a brain disorder. And when we talk about trying to understand it as a brain disorder, what I mean is, in a lot of contexts, people are can easily understand about physical illnesses better because there's a clear pathology as compared to mental illnesses, where sometimes or rather I would say more often, due to the nature of the ongoing research, we are yet to be able to sometimes clearly delineate which part of the brain is actually affected. So I think regardless of that, I think it's always easier and simpler to try to understand that just like physical illness, the mental illness also occurs as part of a disorder or pathology in one part of the organs of the body. And in this issue, in this area context, we would consider it as a disorder of the brain. All right. So when we talk about heart disease, for example, because we're talking about physical health as opposed to mental health, right? Or even as stroke, what we understand is that a heart disease occurs because there's a blockage of a vessel in the heart, as opposed to the stroke, where there is a blockage of the blood vessel in the brain, right? So with these two illnesses, if we were to talk about it in the past century, decades ago, or maybe centuries, right? No one actually knew about this, right? The researches on this came up because there were more mortality. There were people dying because of this, and therefore more researches were done. And finally, we found out, the possible cause for these two physical illnesses, right? But regardless, by now, the researchers has come up with a point that we know how to prevent these diseases, right? So at this point of time, I think our mental illness also are also headed towards the same, although it's a little slower compared to the physical illnesses, right? But it is also headed the same. So the same concept, between heart disease and stroke, just like any physical health issues, if I were to talk about, mental illnesses also requires early prevention, and we are heading there. We are trying to understand further about mental illness so that we can actually prevent it from occurring, right? Okay, so when we talk about the brain, right, this is a totally complex organ, and therefore it's very difficult for us to understand, and therefore we're taking years, decades to actually try to fully understand the brain, and even until now we probably don't know much, right? So the brain is actually imagine the brain as an organ which is seated there in our head with 100 billions of neurons, and also these neurons are building synapses, we call it, connections, almost 100 trillions of them, right? So this would actually help us to understand, why we are finding it quite difficult to have a full in-depth understanding of how this brain is actually processing, what information we're getting and what happens in, the brain in mental illness, So, and yet, so far, we have already been able to identify that, certain mental illnesses occurs because there are connectional differences, there's some problems in the circuitry in certain disorders, right? So this sort of description actually helps us to understand the uniqueness of the illness in an individual. So everyone's brain is actually wired very differently, but also at the same time, because of the researches that we have done so far, right? We are slowly able to understand or have some predictable patterns that we can notice and arrive at what are the possible risk factors for us to develop these disorders, and therefore we can work on that in the prevention component, right? So, like I said, this brain actually works in, it has a myriad of function. It works in terms of your breathing, your temperature regulation, in hunger, but it also works not only, in sustaining your life physically, but it also actually works in terms of your creative components, your thoughts, your thinking, your personality. So that just goes to show how complex this small 400 grams of organ sitting on your, in your head is, right? So when we talk about the brain in terms of, physical illness, as opposed to the psychiatry or mental illness, this is how I would probably try to simplify how it means, right? So when we talk about, for example, Parkinson's, or we talk about stroke, right? We know clearly that there is one part of the brain which is actually affected. We can actually clearly see it on, for example, on CT scans or MRI, to show that there are these areas of the brain which is knocked out, we call it, right? Which is not really functioning well. But this is not really usually the case in mental illness, right? So in the words of Dr. Thomas Insel, a famous psychiatrist, he described the mental illness this way. So we're talking about traffic jams, right? We're talking about sometimes taking detours, sometimes problems with just the way things are connected and the way that the brain functions. So imagine this map right here, right? Where you see the colorful connections, this is actually one of the brain maps that the researchers has come up with. And you can see how complex and complicated the connections are. So you can, in a way, understand that it's not so simple to try to clearly delineate which area of the brain is causing the mental illness, but at the same time, we are slowly working on this, definitely. All right. Okay. The next thing that I think I would like to raise and discuss about is probably this idea. It's a relatively new idea. It's not entirely new. We are, or rather have shifted towards this, where we think of mental health as a dimension or a spectrum. So we are no longer, in a way, considering a mental health issue or condition as a discrete category or disorder. And therefore, what this new idea brings about is basically that, we all of us lie on a continuum of being somewhat healthy and some, and at the other end of the continuum, possibly suffering, just like in the description in the photo here, where it shows that, the continuum starts from, being very healthy to being able to cope, and then struggling and then developing some illness by being unwell, right? So the same mental health continuum actually is quite helpful because it actually helps us to understand, where we are and how, what kind of help we may be needing, right? So when we talk about, someone who's healthy, definitely this is a person who's most likely, having good self-care. They're able to manage their own emotions well. They're able to break their own any problems or issues that needs to be solved. They're able to do it on their own, right? They are also someone who's likely to maintain a healthy lifestyle, as opposed to the next one where this person has some reactions to normal situations. So these people might be a little easily irritable, right? Easily upset. However, they are still able to acknowledge that they're having a problem. They recognize the limits that they have, and they are able to actually come up and acknowledge and the need for help. So they know that they will need help, and they will ask people around them for help. So these are the two contexts where people are still able to handle things on their own or get help within the own social support, right? However, once we move on to the next spectrum or continuum, right, we're talking about people who are already injured and subsequently worse, they become ill, right? So in these two groups of people, most of the time they are very distressed. They can't really handle things on their own, or they do not have the social support that is required, and therefore they would actually benefit more from the professional care that can be given in the proper healthcare settings, right? Okay, so just gonna stop this discussion of mental health as a continuum. I'm gonna leave you all with this to think of. This excerpt of question was actually given in the book by Dr. Roy Richard Brinker in his book of Nobody's Normal, How Culture Created the Stigma of Mental Illness. And I'm going to leave you with this quote, which he mentioned in the book, right? Someone asked, isn't anyone normal anymore, right? So because in a lot of times when we talk about mental illness, people like to talk about, oh, I'm normal, I'm not mentally unwell, right? And as opposed to physical health, for example, right? So his answer was no, nobody's normal. Normal is just a concept we use to stigmatize certain kind of differences. So I'm going to stop there with this idea of the spectrum, and we'll move on to the next area where we talk about emotions, right? So when we talk about mental health, we can't talk about emotions. And when we talk about emotions, life has its happy moments, exciting moments. Some moments we feel calm, very serene, things are good. And sometimes we feel sad. There are times we feel very lonely. Some causes us frustration. Some causes us a lot of anxiety and anger, and so on. But more importantly, what I'm trying to say here is we need to understand that all these emotions are actually normal life expressions, right? And when we experience all of this, we should stop over pathologizing, saying that, I'm sad, I should not be feeling sad, for example, right? So all of these emotions has a role. They are indicating something to you as a way to take actions to move forward. So certain, feelings like feeling angry might indicate to an unfulfilled need, right? And feeling sad or lonely might be indicating to a need where you might want to sort of feel what we call as, being included or being, invited to certain events, for example, and happy and excitement also has its purpose of, making you feel, satisfied, for example. But at the same time, regardless though of these emotions being normal life expressions, we do acknowledge that there are certain emotions in excess that can be causing some problems here and there. So when we talk about emotions in excess causing some problems here and there, we're talking about, when these emotions become pervasive, too long, not resolving, and sometimes causing dysfunction in our life, impairment in certain aspects of life. And therefore, this is when we may consider that these emotions are causing some sort of mental health problems, right? Okay. So this is just a graphic illustration to discuss, the emotions further. In general, we want to be in the go zone, right? So when we talk about the go zone, it's the green zone where we're generally feeling most of the time okay. We're not feeling all the time happy. We're not feeling all the time calm, but we're okay and we're ready to learn. We're ready to do things, but when at any point of time in our life we start to experience, some sadness, some tiredness, some boredom, or you start to get frustrated, you get upset, angry, these are the moments when we need to start realizing first, acknowledging our emotion, and then taking steps to address these emotions, So some of the things that we can do to ensure that, from this blue, yellow, red zones that we're in, that we get back into our green zone, which is the so-called, a productive zone, if you might want to consider it as, this green zone, things that we can do is, simple things that we can do even in our daily life, taking a moment, step back to drink some water, take a walk outside, talk with others, talk to yourself, self-talk to bring up your self-esteem, for example, do some stretches, simple things, listening to music, right? So this sort of thing sometimes can actually help you to go back into your zone, which is the green zone that we want, right? All right. So moving on, I think it's also important to address the approaches that we use in talking about mental health and some of the mental health treatments, right? So when we talk about this, we're talking about what the psychiatrist likes to use is we use the biological, psychological, and social approaches in our treatment. And why do we do this? Because, like I have mentioned earlier, that yes, the biology plays a role, but in a lot of contexts in a psychiatry or mental health condition or mental illness, the psychological and social aspects actually play a rather huge role in actually precipitating or perpetuating, causing a continuation in the illness. And therefore, I think it's very, very important for us to talk about the treatment in this aspect. So why I'm stressing this here is trying to say that, we are not just doctors who prescribe medication just as it is when we talk about psychiatric illness, right? More importantly, we want to treat the person as a whole, holistically, comprehensively, and therefore we spend time talking to patients, trying to understand their background, and help them through all the possible issues that may arise, contributing to the current emotion or behavioral problems that they are probably experiencing. However, more newer psychiatrists are also including this thing that we call as religio-spiritual approach. So it's currently now biopsychosocial spiritual or religious approach into the treatment. And this is usually done in places where, we countries where, there's a lot of faith practice. For example, in Malaysia, we're talking about Islam, Christianity, and even Hinduism and Buddhism, for example, right? Or even in terms of spirituality, understanding the meaning of life, transcendence, purpose of life, for example, right? So in a lot of the psychiatric issues or mental health issues, if we do not address the religious or spiritual component, I do believe that some people might not have a fully resolved issue, right? Because a lot of us are actually from a background of religious background. So, but however, this is not something that psychiatrists impose. We only approach this if the patient or client wants to discuss in this approach as well. If not, we usually will practice in terms of biological and psychological and also social, right? So when we talk about, mental health trying to understand this, right? We need to understand the risk factors. And when we talk about risk factors, we're talking about things that can be modified and not modified, right? So when we talk about something that can be modified, we're talking about things that maybe the person has control over, right? So in this context, if we're going to talk about the heart problem just now, right, we were talking about, right? We're talking about someone who can actually change their diet, do some exercise, and therefore reduce the risk for the heart disease. And the same way for mental health conditions, right? Maybe ensuring a work-life balance might actually reduce the risk of depression. However, not everything has a modifiable risk factor. And this is where it's very important for a lot of people to understand, right? So for example, even in heart disease, right, there can be a genetic component which causes a person to be more vulnerable to develop a heart condition. And the same way with depression and other psychiatry illnesses as well. I cannot mention this here, right? People would have heard of, childhood abuse and neglect, and these adverse childhood events have actually been found to actually increase the risk for a person to develop depression, substance abuse, some eating disorders, personality disorders, and so forth, right? So, and these are actually things which is not within the control of that individual when you think about it, right? So this might help us to understand why the person have certain behaviors better, and therefore are a bit more able to empathize with them as well. Okay, so the next thing that I would want to talk about is actually about the common misperceptions of mental health or mental illness, right? So people like to say that, mental health is not so common, it can't happen to me, or it can't happen to my family. But actually, it's been found that, at least 1 in 4 adults have suffered from a mental health condition. And if this simply means that, if you have a 4-member family, right, one of you might be having some sort of, symptoms, whether it's shown or not shown, right? The next is that, people with mental health conditions seldom recover. This is very untrue. And in fact, a lot of mental health conditions have better outcome than many people realize. Actually, when we look at studies, right, it has shown that depression, people with depressive symptoms actually recover within 3 to 6 months, right? And even in schizophrenia, for example, a type of severe mental illness, people have been recovering, and those especially who come in early with first episode psychosis sometimes go on to not have any more episodes of psychosis, right? So that's how important it is to come in early. However, it is also important to understand, just like a physical illness, right? Where, for example, someone experiences cancer, or someone has a fracture, for example, right? They do have some long-term consequences, and similarly, there will be a minority of people with mental health problems who have severe long-term symptoms and have significant disability. But of course, it's not so many now with the advent of better treatment as well, and early treatment, of course, right? And the next misconception or misperception is actually treatment for psychiatry is not effective, right? And this probably boils down to the earlier misperception, where people think that people may not recover. But actually, many mental health conditions have been successfully treated. Sometimes with psychotherapy alone, just what we call a stop therapy alone, and sometimes in the most severe situation, they may require medication, right? Okay, so moving on, there are a few things that I think is important to stress, and these are things that we can actually do for a good mental health, right? Because we're talking about the biopsychosocial approach for treatment, right? So among them would be, taking care of your own body, and that comes down to, eating healthy, drinking water enough, not taking too much of substance, being active, getting enough sleep. And next, of course, would be the psychological and social components, finding things that you would like and enjoy to do, getting the social support or help whenever you need, find someone you can trust to talk to, and finally, if you really need help, look for the professional help whenever necessary. Okay? So this is something that people always tell those with mental illness to do. Pull yourself together, right? Or just snap out of it, and then we wonder why people, stop talking about their mental health condition. So hopefully, with all the explanations so far, you will all be able to understand why people can't just snap out of it, nor can they just pull themselves together. Right. So breaking away from stigma. So when we talk about, snap yourself out of it, or, put yourself together, right? These are statements that can be quite, stigmatizing, because people think that, these people are just not doing enough, and therefore they just need to put in more effort, and then they will get better, right? So when we talk about, stigma, what we're talking about is basically, stigma itself literally means disgrace or, dishonor. So when we stigmatize a person, we are sort of, disfavoring these people, this group of people. And WHO has identified stigma and discrimination as the single most important barrier to overcome in the community, so that more people will come forward and get treatment for mental health conditions, right? So I'm going to just give you a little exercise here. It's not a poll. I'm not going to know your answer. You know this yourself. I just want you to step back and think about this. Let's say someone assigned you to give a talk tomorrow at your workplace, right? And you have been thinking about this talk for many days, but you're not very comfortable, you're not very confident doing it. So the day before the talk, you decided to call your boss and tell your boss that, one, I'm down with flu, I'm down with cold, right? So I can't give the talk, right? So, or two, you might tell your boss directly, no, I'm panicking, I'm feeling too anxious, I don't think I'm going to do this well, so please assign someone else to do this. So think about it to yourself. Which one would you have told your boss in this kind of situation? So if you were to have chosen the former, which is, blaming it on a physical health, although you actually have been having a lot of anxiety, rather, that is also a form of stigma, right? That is also a form where we do not want to, openly speak about our mental health or emotion problems. Rather, we separate them into the physical health and blame it on that, rather than talk about the mental health, right? And I think what's most important at this point of time is to bridge this gap, right? Start talking about physical health, about mental health, similarly like how we would have talked about physical health, right? Okay. So when we talk about stigma, right, we're talking about the various effects of stigma. So stigma often leads to a lot of discrimination. There's a lot of inequality for an individual. They are not able to do their rights and responsibilities because certain limits have been put on them. And this actually can prevent a person from seeking treatment, from adhering to treatment. Why should I be taking medication in front of people? It's embarrassing, for example, right? Finding employment, living successfully in community, all of these issues will arise because of the stigma. So when we talk about stigma, it's important to understand what are the common types of stigma. So one of the common type of stigma is what we call as public stigma. And public stigma actually comes in from the reaction a person in the society or public have towards an individual within a group that they don't really, like or have a negative idea about, right? And the self-stigma, on the other hand, is the internalized stigma, the negative thought or behavior or attitude that the person has towards they themselves. If they have the illness, what will happen? What will people think? So it brings down their own self-esteem, for example. And finally, another common type of stigma is what we call as courtesy stigma. And in this courtesy stigma, although it sounds so courteous, it actually means that, a person being stigmatized just by association because of their connection with a family member or a friend who has the illness, right? So all three of these stigma are quite common if we look into ourselves and into people around us, and should be addressed definitely to ensure that the harmful effects of stigma, as what we were mentioning before, can be handled, right? So how do we actually end stigma? So when we talk about ending stigma, first of all, we need to have a good education, educate yourself, educate others around you so that, people can proudly come out and talk about their problems, right? Next, share real life examples of people with mental health disorders. Research has shown that, sharing narratives of true people, to real life story, actually helps people to empathize and actually help others to come out also when they have problems, right? Next, just like how I explained earlier, it's good to explain that mental health has a spectrum and a range of symptoms, right? And therefore, it's important for us to understand that, any of us can be at any part of the spectrum at any point of time. And that might help us to understand people with the underlying illness better and end stigma. Next, listen non-judgmentally and support others with mental health concerns. And finally, share stories of overcoming mental health disorders. The brave, courageous stories of people who came out and got treatment are the kind of hopeful stories that we hope to hear more, so that we can encourage more people to come and get treatment for mental health conditions. Just like how, we talk about people in Magna, coming out to talk about, breast cancer survivors, so these are the things that we want to hear about mental health as well. And we hope it can help to end stigma, right? So I think this is probably my last slide. We can't end a talk on mental health without talking about resilience and hope. And why so? Because resilience and hope are both what we need to move forward. On moving forward, we need resilience. And what is resilience? It's basically, your ability to bounce back regardless of whatever life challenges have given us. We want to be able to come out back from the challenges, come up stronger, and hopefully do better, do kinder, right? And to have this resilience, to come up back, to bounce back forward, sometimes we need hope, right? Because this hope is what keeps you going no matter what. This is the anchor to the soul. It's what you need to be courageous to take that new step to bounce back. It's a belief where you say, I can do this, on moving forward. And therefore, for mental health, I think these two are the two important components in recovery in the recovery process. So that's all from me. Thank you, and I'll be happy to take any questions.
Okay. Thank you very much, Aishah, for sharing this information about mental health, and also help us to understand better about what mental health in this modern era. I think this particular sharing has sparked two interesting questions over here. So I would like to first start with Iris. So thank you, Iris, for joining today's sharing. I think Iris has tried to ask about a more severe form or slightly more serious form of a mental health issue. This is where she has seen somebody who has been complaining of her hearing voices. So one of her client is actually on treatment with a private GP, and the client of hers is actually experiencing hearing voices. Maybe Dr. Aishah can share with the audience what does it mean when one of the client come to us with hearing voices.
So when we talk about hearing voices, right, these are one of the possible symptoms of what we call psychosis, right? And what happens, why is this different from the usual individual is these voices are voices that other people can't hear, right? So when we talk about hearing voices or auditory hallucinations, that's what we mean about, we're talking about, having voices or sounds that usually other people can't hear, but they themselves can hear. So it depends on their condition. Some people may acknowledge it as being abnormal. However, some may actually consider it as very real and real enough to be true. So that is something that we need to address when we see the client, definitely.
Okay, just maybe to follow up this, Dr. Aishah, then is it real or is it not real? So, what do you think about these voices?
The voices in general, we as a psychiatrist, we have a series of questions that we will ask usually in our clinic setting to establish whether these are real sounds or not, right? So if the voices or the sounds, after being established that there were no, real stimulus around them, for example, so this could most likely be unreal in the context of how do we explain this, maybe it's unreal for other people because they're not experiencing it, but it could be very real experience felt by the person experiencing it. But regardless, it is something that requires treatment if we find out that it is a true hallucination rather than, just maybe a false illusion, for example.
Okay, so Iris also would like to know if this client come to us with presenting with hearing voices, what should we do? Or is there any blood test or is there any brain scan that we can do to help us to make a diagnosis?
Okay. I think in general, when we talk about psychosis per se, we need to investigate first what could be the causes, you see. So in hallucinations, there could be multiple causes, including what we call as medical causes. So yes, we will do some blood tests to run through and possibly if we do think there's a need for a brain scan in cases of maybe, fever, indicating that there's some brain infection, for example, or a head injury, for example, we may consider to move forward with a brain scan as well. But however, in a lot of contexts, if we're talking about it being a functional psychiatry illness rather than relating to an organic or a medical condition, then most of the findings would be negative, and therefore we would the blood investigations or scans may not be necessary. Yeah. So depending on the situation. But yes, we do blood tests to actually rule out medical conditions first before assigning it as a psychiatric condition.
I see. So Iris also would like to know if we are suspecting this particular person is suffering from schizophrenia. So what kind of tool or what kind of assessment could we offer for this group of clients?
Okay, I think in general, we do not, we as a psychiatrist, for schizophrenia per se, once we have ruled out medical conditions, we would probably use our DSM-5, which is the Diagnostic and Statistical Manual for mental health problems, to actually diagnose. It's a set of criteria where if a person fulfills the criteria for schizophrenia, for example, then we would consider them as having schizophrenia. We don't usually do scales or tools. We don't usually use it in a clinical setting, but we do use it in research settings because it's a bit time consuming. But that could be another additional thing that we can try to do if we need further confirmation in certain cases. Most of the time, we will usually use our DSM-5.
Okay, thank you. So Iris, last question from Iris is that if this client is suffering from auditory hallucination or schizophrenia, so what could be the prognosis for this particular person?
Okay, I think in terms of schizophrenia, right? In terms of auditory hallucination, I guess it depends entirely on the underlying illness, right? So if it's a mental, relating to a medical condition or, for example, substance use, right? Treating the medical condition or stopping the substance use may help with the auditory hallucination resolving, and therefore they have a better recovery once we treat the underlying illness, right? But in terms of schizophrenia per se, it varies on a lot of things, to be honest. It depends on, how fast the person comes in for treatment, the duration of untreated psychosis, we call it. It depends also on, how the functioning of the person was prior to this, and also on the response of the person and the tolerability of the person to medications that we're going to offer. So in a lot of condition, most of the time, if they come in early and get early treatment, we are very, very hopeful and optimistic that a lot of them will actually recover and can actually work as usual. Yes.
Okay, so this is another question, but this is from Anonymous. So this particular participant is actually asking, this participant is actually recently saw a doctor who diagnosed this particular participant with TRD anxiety disorder. So I'm not too sure what is the short form TRD stand for, but I have a guess it might not be TRD, it might be TRO. So maybe it's to rule out anxiety disorder. So maybe let's start with this, because if the short form is TRD, it means another potential mental illness called treatment-resistant depression. So I have a feeling it might not be treatment-resistant depression. Let's look at what if this is just anxiety disorder. So Dr. Aishah, can you help to explain a bit more about anxiety disorders? And because this particular participant, it's receiving certain challenges in terms of workplace, especially during this COVID-19 period.
Okay, all right. So thank you for that question. I think in general, anxiety is something that everyone experiences. I think, to be honest, me coming into this talk, was also quite anxiety provoking in a way, right? So all of us have our levels of anxiety and anxious feelings, right? And of course, it varies in intensity, in frequency, in also how it actually affects us, right? So a certain level of anxiety in a lot of us will actually be quite helpful in certain aspects. For example, preparing for exams, preparing for this talk, for example, or, preparing for a big project, right? However, if this anxiety is too persistent, right, or chronic, we call it, or sometimes it causes you to not be able to think clearly, it causes some problems in functioning daily, right? So this is when we would consider a possibility of diagnosis of anxiety disorder, again, to rule out, TRO, most likely what was the short form, like Dr. Ang says, is how to rule out means it needs to be worked on for us to establish which diagnosis it is. So, a psychiatry diagnosis is not something that you establish just, by a single short consultation. It's something that we sit through, talking to you, trying to see which part of the life is affected and which particular anxiety disorder would you be fitting more in, because there's a variety of anxiety disorder. For example, panic, we have social anxiety, you have generalized anxiety, for example, right? So for us to be able to speak about anxiety simply, it's not so simple. That's what I'm trying to say. However, considering that you have come for treatment, at least for the first part, right? And then you are asking about how to go about, I would consider it as a good start. First step in everything is acknowledging that we have a problem and then asking for help. So in terms of anxiety, if we know what are the things which are causing us anxiety, I think it'd be good to address those issues first. And if there are something that is within your capability to address, it'd be good for you to do it on your own. But if you can't, then it's always good to ask people around you or get even professional help from the doctors, for example, to actually help you through your anxious feelings, right? So if this is something which is memang very troubling, very, disrupting your daily function, I would suggest you come in for a formal consultation, and we can do more further things necessary as per necessary.
Okay, thank you for the answer, Aishah. And also, this particular participant is highlighting that there's there's a bit of a challenge at the workplace because the workplace tends to be a bit judgmental. Sound like there's some stigma attached to the mental illness. So the participant would like to know how to go about in seeking help because the participant has realized some changes in him or her. So
Okay.
what's your advice?
Okay. In general, whatever there's a few ways of addressing this, right? So if you think that this anxiety is something that you can handle, like I said, between you and your colleagues and your friends, for example, just getting the social support, then that's enough. You don't need to do anything further, right? Sometimes it's just some lifestyle changes, making some changes to your, work schedule, for example, mixing with a new crowd, for example, lesser meeting with people who might be toxic, those who might be that judgmental in your work environment, minimizing contact with them. Those are simple things that you can try at your work level itself. However, if you think that you do need psychiatric help, for example, I think it's always best to just come in. And one thing that we would always like to stress is whatever you come, whatever consultation that you come for, in the psychiatry clinic is always kept as private and confidential. So there is no worry about, your work colleagues or, your bosses knowing about it unless you yourself would want to make it known, for example. So I think in that context, it should actually be all right for you to come to seek a proper formal help.
Okay, so yeah, there's one more question over here. Can diet and exercise make a difference? So this is from Frida. Thank you, Frida, for the question. So for Aishah, can diet and exercise make a difference?
Okay, I think it depends on what are we exactly talking about. If we're talking about, maintaining the mental health or the mental well-being, yes, definitely there is a huge role for diet and exercise in the sense that, eating healthy foods, just like how you take care of your physical health, for mental health is similar. Similarly for exercise as well, it has been found, the regular exercise with the release of endorphins and all, the feel-good hormone actually helps you to feel better, focus better, rest better, sleep better. So in general, diet and exercise definitely would help in the mental well-being. However, if we're talking about, diet and exercise per se as the way to go about to treat a particular mental illness, I would say that their role is supportive rather than, the only treatment. Because in a lot of these conditions, when it's already at the level of illness, it requires something a little more, what we call as, macam a bit more particular lah. Dia ada macam standard benda yang we have to give to actually treat the illness. But these exercises, especially in mood conditions, definitely have been found to be very, very helpful to improve your mood. Yes.
Okay. So I think we had quite a fruitful discussion today. We have a few questions. We'll come and talk about a variety of mental health related issues. Maybe help us to understand also, Dr. Aishah, is that we know that we are in the COVID-19 pandemic or near to the end, hopefully, of the COVID-19 pandemic. Do you foresee or do you see changes in terms of mental health of the population? Or is there anything that you would advise the general population about, especially on the mental health?
Okay, I think with the COVID pandemic in general, a lot of anxiety. It started with a lot of anxiety because there were so many uncertainties, and now once things are a little settled, in the sense of we know how to go about doing things, but there are people coming out with depressive symptoms rather because they are not able to make ends meet, for example. A lot of plans have been put on hold, right? So I think in general, yes, we are seeing a rise in especially these two particular areas of mental health condition, which is anxiety and depression. But more also, we need to talk about people who are already having, some psychiatric illness, which because of the COVID pandemic have not been able to come to get help, because of PKP, the movement control order and all, they've not been able to come and get treatment, for example, due to the road closures and all. So all these groups of people have different issues that we need to handle or tackle, right? So in general, the advice I can give is if you think you need help, come in early, get the help that you think you may be needing. In terms of anxiety, learning to slowly let go of things that can't be in your control, letting go with the flow sometimes help. Stop having plans, fixed plans, be a bit more flexible with our plans, because this year has taught us that plans sometimes can't be completed, those kind of things. So I think in terms of the anxiety, that might help. In terms of depression, again, our goal settings, our expectations of things in our life, this is end of the year after all, this is the time we look back at our year and think of what our achievements are. And at this point of time, I think a lot of us have to change our perspective that surviving until now, in the sense of being able to do small things that you used to have taken granted for, by now that's the biggest achievement for the year, compared to before this you'll be thinking, oh okay, apa yang I dah buat dah for the year kan. So that has to be the difference lah. So I think that can be that's probably my message for these people.
Okay, I think that's very true, and I would like to close today's webinar with also mirroring what Dr. Aishah said about resilience and hope. I think this is a time that we reflect back to the whole year and be grateful for our health at this moment, and to be grateful for our loved ones with us. And I think for those who needs help, I think help is available. To most of the government hospital, we have mental health services in most of the government hospital, and also to some of the clinics. But in UPM, we are offering psychiatric services throughout the day. So from Monday to Friday, we actually offering psychiatric services. You can actually drop by if you have needs, or if you have a referral letter from any of the GPs or any of the other doctors, please, you can always drop by, and we would be more than happy to help you with your issues. So with this, I thank you everyone for your attention. I think it has been a great journey for our department to share some important information about mental health. And I think it would be great that we could give a big clap to Dr. Aishah. Thank you very much for your time and also for your sharing. And I think we will see each other in the future, and stay safe, everyone. Okay, bye-bye.
Thank you, everyone. Take care. Stay safe.
Bye.